Namaste. Rest and relaxation are important for our biological and psychological health. However, a few are able to put this into practice. And to discuss this subject, we have with us, of course, our psychoanalysis consultant, Mr. Himanshu Vaidya. And he's the one who has even coined and created this term and the therapy. So let us quickly ask him to join us and explain what is rest and relaxation. Namaste, sir.
Namaste.
So, sir, how do we start? I mean, what is rest and relaxation therapy? Can we start with that?
Rest is different from sleep. In sleep, we are partly unconscious. Rest is when we stop our physical and psychological activities and we are awake and aware. That is a state of rest, very different from the state of sleep. And this state of rest is very necessary for well-being, both biological and psychological. A 20-minute rest every day does quite an amount of good to our well-being. When we are taking rest, the contraction, the anxiety, the stress in our system starts reducing. We see the contraction in the muscles going away, the tension on the skin going away. And when that contraction goes away, naturally we feel relaxed. So relaxation happens when we take rest. However, relaxation is different from rest in the sense, even when we are at work and we are not taking rest, we can take 20 minutes off at work to undertake some relaxation. So people do relaxation between work, or they set apart a point of a period of rest and they do relaxation. Some people even do a kind of active relaxation, that they are not using that rest mode to get into relaxation, but for them, reading something is relaxation, walking in the garden is relaxation, talking to somebody is relaxation, watching a movie is relaxation. So relaxation can happen even without rest, and relaxation can happen even with rest. And both of them are necessary. Rest and relaxation are both necessary for our well-being, regardless of which therapy we are using. The fundamental problem is that any person who is facing a challenge of psychological well-being always feels either anxiety or agitation or restlessness. And rest and relaxation always are generic goals of any form of psychological problem and any form of therapy. It is just that we believe that when the psychological problems are taken care of, the state of rest and relaxation will make an advent by itself. It will be the default condition into which you will move once your psychological problems are healed. And therefore, there is a misnomer, there is a misunderstanding rather, that it's only when you solve the problems for which the person has come, a person can move into the state of rest and relaxation. And this is not true. We can move into the state of rest and relaxation. Most of us can, barring a few exceptions. We can move into the state of rest and relaxation if we will it, if we are facilitated, and we are given tools to enjoy that state. It is a very enjoyable, peaceful, blissful state. It is also the goal of spirituality. It is also a goal for many people as the goal of life to get into a state of peace, bliss, rest, and relaxation.
So, how did this idea evolve of rest and relaxation?
It evolved from two different points. The first point was, I was always extremely interested in uh, healing the person as fast as possible. And that led me to think about what happens between two sessions. Is the time being wasted? Can something be done between two sessions by the person himself or in assistance with somebody else? And that led to the idea of self-work. And I realized that most people are not able to do any form of meaningful self-work. Somehow, something or the other prevents them. At times it is the pathology, at times it is lack of discipline, at times it is ignorance, they don't know how to do it, and they get frustrated. But somehow or the other, between two sessions, the self-work does not happen. And that led me to another idea. Can we have a junior therapist or a self-work coordinator to facilitate this self-work between two sessions? Since people are not, when most people are not able to do it on themselves. At least this is true of the people that I have seen around me. Maybe in some other country, people are more disciplined and knowledgeable. That's a different context altogether. But in our context, most people are not able to do self-work, and therefore I thought of maybe a junior therapist, a self-work coordinator can be put in to help the person make use of time between two sessions more productively. This was one point. The second point was I felt that most people who have any sort of psychological problem, they always are deprived of rest and relaxation. In fact, rest and relaxation become the goal states that we want to be free from this continuous anxiety, agitation, anger, all these negative emotions which are active. We want to deactivate these negative emotions and we want to enter into a state of rest, relaxation, peace, and bliss. Somehow they are not able to do it. And this takes us to uh, the point who can do it and who cannot do it. So if we look at the problems in the form of mild, moderate, and severe, maybe the severe problem category, rest and relaxation may not be possible till you really deal substantially with the pathology. However, for mild and the moderate part of the that part of moderate which is towards the mild, that section, even while the pathology is being addressed slowly, even if it is substantially not addressed or healed, even then it is possible to get into a state of rest and relaxation if we are facilitated. It may not still be possible to do it by oneself, but if facilitated, let us say you have a session on every Monday and Friday, and on Wednesday or Tuesday, or maybe Tuesday and Wednesday both, there is a session for rest and relaxation, or there is a session for self-work, or one session for self-work and one for rest and relaxation. It's making more productive use of the time between the two sessions. And if somebody facilitates relaxation, I have seen that it may not be possible for many people, just as it is difficult to do self-work, equally difficult to do rest and relaxation. But if facilitated, if you convert it into a structured activity, say Wednesday 3 to 4 every week, it becomes more of a doable thing. And once for the first 2-3 months, people experience this guided relaxation, then it becomes a habit and people can independently do it on their own far more across the day and be in a state of much better uh, pleasure and peace than otherwise. So these two things, my observation of how self-work does not get done in India and how people are not able to do rest and relaxation although they want to, just as they are not able to do self-work although they want to. And in both cases, I thought a structured guided facilitation can work. And this, when I explored further, I came to realize that it can be offered independently as a rest and relaxation therapy, where we can go in details of what tools to use for creating the state of rest and relaxation with a person with a personality X and a problem Y, and so on. We can go into the specifics and details of it and have a basket full of tools to take people into the state of rest and relaxation. And with Zoom and online possibilities, this is even more easy for one facilitator to guide many people into a state of rest and relaxation, and it's very rewarding. We feel the feeling of peace and bliss in that state of rest and relaxation. This is what all of us want.
Sir, if you can quickly tell us how is it executed and what makes this approach so important?
Let us say there is a facilitator and 5 people have approached to enroll for this particular program. So they meet at a particular time, online or offline, whatever the case be. And then the facilitator uses tools to facilitate rest and relaxation. For example, let me name a few tools. Say tool number 1, which is just sitting comfortably, closing your eyes and watching the breath coming in and going out of your nostrils. It's a very popular meditative technique used by many schools in spirituality. If you do it for 5 to 10 minutes, you will feel calm down. Say another tool is to breathe in through the nose and exhale slowly through the mouth. And you do it for 5 to 7 times. And that also calms people down. Many people have reported calming effects in terms of palpitation, anxiety, and so on. Reducing down, of course. Take the example of the guided visualization relaxation, where people imagine a white light relaxing them slowly. Take the 4th method of direct observation without any tools. You just move your attention and awareness on all the tips of the fingers of the hands and try to feel the sensations here. Do the same with the legs. Then focus on what you hear all around. And then just watch the breath coming in and going down. This itself calms us down. So there are many ways of calming down our system, of getting it into a state of rest and relaxation. And as we go deeper, we can do more research and find out more refined techniques to quickly and deeper get into those states and get maximum benefit out of those states.
So can you explain, can you even talk a little about the 3 categorical approaches you often talk about?
Yeah. So conceptually, what we understand here is that we look at 3 categories of states. The first state is of rest and relaxation. The second state is of contraction and agitation, excitation and contraction. The third state is of inertia, indolence, and indulgence. It is necessary to understand the 3 to understand this approach better. First is the state of rest and relaxation, where we feel the whole body is at rest, relaxed, and there are no contractions in the body, no tensions, and we see a kind of a suppleness and looseness and the expansiveness in the body, inside the body. A kind of freedom in the body. Let me not use the word expansiveness, but freedom in the body. And we experience bliss and high awareness. Second state is the state of excitation and contraction. So if we look at our pleasures, all our pleasures can be divided into 2. Pleasures which are excitation and contraction pleasures, and pleasures which are non-excitation and freedom pleasures. So when we look at all the sense pleasure, the ego pleasure, right, certain forms of emotional pleasures, they by and large result in some sort of excitation and contraction in the body somewhere. If not anywhere else, at least in the brain. But when we look at certain forms of pleasure, like listening to a spiritual discourse or certain spiritual experiences of peace and bliss or certain very good music, we don't feel that kind of contraction pleasure. We find, or say you do something selflessly for somebody, we feel a different kind of happiness, which is not related to the excitation contraction type. It is more relaxed and more free and more of an expansive type rather than the contracting type. So this rest and relaxation state and the peace and bliss we feel there is very different from the other state of excitation and contraction. And the third state is of inertia, indolence, and indulgence, which is on the surface mimicking rest and relaxation, but actually is not rest and relaxation. So we have to be careful that when we try to induce the state and maintain the state of rest and relaxation, we don't get into inertia, indolence, and indulgence. Inertia comes from doing nothing. Indolence comes from getting into a state, a kind of a stupor-like state, and indulgence comes from some form of addiction of some form. And they also induce a state which looks like rest and relaxation, but it is not rest and relaxation. It's a pathological state altogether. It's not a well-being state.
So can this therapy be used as a standalone therapy, or is it a secondary therapy as a support therapy?
For people who are healthy and don't have any problem, this can be used as a standalone therapy as a preventive to enhance the quality of life, because ultimately everyone enjoys rest and relaxation, and it will prevent the psychological problems as well as psychosomatic issues from developing. And this is something all of us need badly because we are running around so much without adequate rest and relaxation. So this is one part. Second part, where somebody has a problem and is taking professional help, this can be a complementing therapy. That the main therapy is doing its work, but this is a complementing therapy. And I believe you may not use the word therapy, you may use the word complementing help or whatever you want to call, right? But I believe that at least in the situation that we are, we require a kind of secondary help for self work and for rest and relaxation for people who are in under some form of treatment for a psychological issue. So for them, it becomes a complementing therapy. In a rare case, somebody who is interested in spirituality and mystical experiences, this can also be a door to get into those rare mystical and spiritual experiences.
Okay.
Because in spirituality, many gurus use this technique that they first ask you to rest and relax and not get involved in 1,000 directions. Because in the state of rest and relaxation, the spiritual process of self-observation and self-transformation is better done than in the state of excitation and restlessness.
So, sir, what are the applications of this therapy?
One as a preventive, as a preventive, second as a complementing therapy, third as a door to spiritual and mystical experiences, and fourth for research to find out what it can do for our biological and psychological well-being, and five, to enhance the quality of life because it gives us peace, bliss, awareness, rest and relaxation, which we all want. So it definitely is a enhancer of quality of life. So these five are very easy to count beneficial outcomes of it.
And so, are there enough tools to help this therapy, or that can be bought into this therapy and used?
I would say yes and no. Yes, in the sense that in different approaches, different spiritual schools, different mystical schools, uh, those who are doing sleep research, those who are doing relaxation research, those who are into yoga and particularly yoga nidra type of part of yoga or shavasana type of yoga, research in that kind of thing. Uh, if we collect all the tools that they have created till now, we will have a big basket full of tools. But even that big basket full of tools, while it's a big basket, it is still not enough. So we need to create more tools which are more effective and quicker to get us results. And we need more tools which can be used in a do-it-yourself mode. Because ultimately we believe that after 3 months of this rest and relaxation therapy, a person should get independent and get in a do-it-yourself mode.
Sir, how can this this therapy can it be effectively rolled out? Can it be used, and how, if yes, how?
The good part of this is that it can be rolled out online. So you can provide it to any person anywhere who is online and understands your language. So the only two barriers are the language and availability of internet. And people can be in their own homes and do it. Or if people have some space near their offices where they can go, or if the offices are providing a well-being room where they can go for 20 minutes or half an hour, all of that can be done. And I'm sure if we explain empirically the benefits of it, the human resource departments of companies will give time of 15 to 20 minutes or half an hour for well-being of their employees, at least for those who are facing from high stress levels. So the rollout can be done online. Rollout can be done only to domestic. Rollout can include the domestic, people who are living in households. It can be done at any point of the day, any time of the day. It can be done to include organizations. It can be done to include far-flung rural areas. You can also go across the national boundary, do it on a global scale, limited only by language. You can put in different language people. And if you have a call center kind of situation where you are providing global services, global relaxation services to people across the world, and you have people from different languages operating that center, right? You can call it a call center or relaxation center, whatever. That can actually provide a very good service to everyone around. So there is high scalability built into this approach.
I'm sure it would be very helpful. It is such a simple and easy to do kind of an approach.
Yes, and as we go deeper into it, we will go into the profoundness of relaxation.
Yes,
Because
which is kind of myth. We have in the hustle and bustle, we've kind of shooed it away. It is so much not on our priority.
yeah, it is like what Heidegger would say, too near to be found.
Okay.
And in yoga, they have explored this complete ranges of relaxation.
Hmm.
Hypnotherapy, you explore degrees of relaxation, from mild relaxation to getting into a trance. Right?
Hmm.
Similarly, yoga also has explored the range of psychological states in relaxation. So there we get into the profoundness of this whole area of relaxation and what experiences one goes through in different states of relaxation. So relaxation there becomes a subject of study by itself, just as Sleep has today become a subject of study by itself.
Right. Thank you so much, sir. And it was always, as always, it was a pleasure to talk to you and discuss about this such simple and productive topic. Thank you very much. And namaste.